Yes, yes, yes. क्या नाम लगाते हो यार? Chalo, let's start. All of you, fine. All those online, audio visuals clear, no issues with this. Okay? So let's start. In a hospital, systematic observation and recording of doctors spending time with patient's care and time without patient's care. So spending time with patient's care and without patient's care is calculated. क्या हुआ? अच्छा कमिटी बच गई अपनी ना. हाँ पहले ये करके करता हूँ. Without patient care is calculated for future management purpose. The type of management method used is, this was a question from August. So this is known as a work sampling. This is known as a work sampling. So where from any profession usually you try to compare the efficiency of his work, the time he spent with the patient or without patient. This kind of any study which is conducted in any profession, whether it is a hospital with doctors, nurses, anything, it would be a work sampling. Now, if I talk about other health management techniques that we have, so please remember, one is network analysis. In network analysis, the two things which are included are, first is PERT, and second is CPM. PERT is program evaluation and review technique. It is known as program evaluation and review technique. Whereas CPM is the critical path method. That determines the longest part to carry out a task. Okay, that determines the longest part to carry out a task or to carry out a health program. That is what is CPM and PERT. So program evaluation and review technique or critical path method are a type of network analysis. They are a type of network analysis. No issues with this. Next one that we have is system analysis. Next one is the system analysis. In system analysis, we will compare more than 2 health programs. Okay, we will compare more than 2 health programs in the results achieved, and that is what is system analysis. Next one we have is cost benefit analysis. By the name it is evident. Here we will evaluate or we will calculate the output of a health program in monetary terms. We will calculate the output of a health program in monetary terms. That means, for example, if we launched NTEP program, National TB Elimination Program, after launching this program, how much disease burden on the society decreased, and therefore how much money that we saved. That is what is a cost benefit analysis. Here we calculate the results of health program in terms of money. That is cost benefit analysis. Last is cost effective analysis. Here we will calculate the results or output of a health program in terms of results achieved. And that is what is called as cost effective analysis. No issues with this. In terms of result, cost effective analysis. In terms of money, cost benefit analysis. PERT and CPM are a part of. When more than 2 health programs are compared there, it is known as. And when in a profession we compare the groups, it is known as work sampling. Talking about committees. Okay? सो हेल्थ कमिटीज बहुत सारी आई थी, फंडा है अपना याद रखने का, तो जल्दी से याद रखते हैं. फर्स्ट केम द घोर कमिटी इन 1943. ठीक है, so this घोर कमिटी bored us with recommendation of PSM for 3 months. They bored us with the recommendation of, so out of 12 months of internship 3 months should be PSM. ये बोर किसने किया था आपको? घोर ने. So घोर committee bored us with PSM 3 month mandatory internship. Okay, next. Okay, घोर committee also gave the recommendation of 1 PSC per how much population? 1 PSC per 40,000 population. 1 PSC per 40,000 population. At least remember this. And next, Ghor committee also worked on school health. Ghor committee also worked on. So the first committee who worked on school health was. This was a direct question. Next, Renuka Roy committee came in 1960, gave recommendations in 1961, and it worked on comprehensive school health. So which committee worked on comprehensive school health? So औरतों को ज्यादा प्यार होता है बच्चों से, ठीक है, तो ऐसे याद रखा है मैंने. तो रेणुका राय committee worked on comprehensive school health. Then Mudaliar is a South Indian. So here Mudaliar, usually South Indians are more in the IAS cadre, usually IAS IPS cadres. दो लोग ज्यादा होते हैं. So Mudaliar also gave a recommendation of Indian Health Services, IHS cadre. Okay, so Mudaliar gave a recommendation of Indian Health Services, that is the IHS cadre. Okay, important. Next, Chadda committee. Chadda चड्डी में सोया था, उसको मच्छर आके काटा, so therefore he worked on National Malaria Elimination Program. Chadda worked on National Malaria Elimination Program. क्यों? क्योंकि उसको मच्छर ने काटा. Then Mukherjees are in high numbers in Bengal, right? So उनको लगा अपनी population बहुत बढ़ रही है, and therefore they worked on the family planning program. Right? So they de-linked the family planning program from the National Malaria Elimination Program. They de-linked which two programs? Family planning program from the National Malaria Elimination Program. They made it two individual programs. Next, Jungle wala committee ने जंगली recommendation दिए, and what? And those jungly recommendations were ban on private practice. They gave a jungly recommendation on ban on private practice of government doctors. Okay, no issues with this. Last, Kartar Singh committee. Kartar Singh is a Punjabi. No offense to any Punjabi over here. Mostly Punjabis, they are united. Okay, they come in unity, and therefore they thought to have a union of healthcare workers. And the union of healthcare workers to be started was multi-purpose worker. So multi-purpose worker recommendation was given by. Last that came was the Srivastava committee. उसके बाद भी बजाज है, उसके बाद भी अभी आ रही है, but at least Srivastava committee, you need to remember that the first 3 letters of Srivastava are SHR. You need to remember those in the reverse direction. That is RHS. That means they gave the recommendation of referral health services. That means in Indian system of health, we have primary level, secondary level, and a tertiary level. So primary level is PHC, from where the patient is referred to. Secondary level, that is CSC or district hospitals. From there, the patient is referred to tertiary level, that is medical colleges. Okay? So this is what is the referral services. And this referral health services was given by Srivastava committee. Referral health services recommendation was given by Srivastava committee. They also gave the They also worked on Rome. Okay, they also worked on medical education. No issues with this. I hope so. इतना कम से कम याद रहेगा. तो जल्दी से. Who bored us with 3 months of PSM? Which is the first committee to work on school health? Who gave the recommendation of 1 PHC per 40,000 population? Which committee worked on comprehensive school health? Renuka committee worked on Indian Health Services cadre recommendation was given by who worked on National Malaria Elimination Program? कौन सा था चड्डी में? Who worked on malaria? Chadda. Mukherjee de-linked which two programs? They de-linked family planning program and National Malaria Elimination Program. Kartar Singh committee gave the recommendation of Multi-purpose worker at which level? Sub-center level. At which level? Jungle Wala committee made a jungly provision of. Srivastava committee worked on referral health services. Okay, Srivastava committee worked on referral health services and also on medical education room. Okay. Now, best indicator of disease burden in a society is DALI. Ye one liner hai. Okay. Best indicator of disease burden in society is disability adjusted life year. What is DALI? Disability adjusted life year. Okay. So a patient was diagnosed with cancer at 50 years of age and he lived till 80 years of age. So the 13 years he spent with disability or cancer is termed as DALI. So disability adjusted life years is known as DALI. And best indicator of disease burden in society is DALI. Maximum DALI are seen with which disease? Ye question the one liner. Maximum DALIs are seen with? Maximum DALIs are seen with? एक कोई बता दो. Maximum DALIs are associated with depression. Maximum DALIs are associated with Shabash Gayatri. It is unipolar depression. So maximum DALIs are associated with unipolar depression. Maximum DALIs are associated with unipolar depression. Depression में बहुत सारे लोग हैं, बताते भले ही ना हो, ठीक है? तुम्हें भी लगता होगा. So now, what is the IQ or intelligence question of a 8-year-old child with mental age of 6? So IQ is to be calculated as mental age upon chronological age into maximum chronological age that can be inserted is maximum chronological age that can be inserted is 15. उसके beyond नहीं जाता. भलाई though the patient is 20-year-old, then also you will take the chronological age as 15 over here. So Einstein हो क्या भाई? So mental age कितना है बच्चे का? So the mental age given is 6 upon the chronological or actual age of the child is 8 into 100. How much it is? It is 75. Okay. So 75% is 75 bolio. Okay. So child falls in which grade of intellectual disability? The child falls in mild intellectual disability. So important है. So imbecile, moron wala वगैरह they can ask you at times, but the more important one is the WHO classification of intellectual disability. Intellectual disability is the new name for mental retardation. Most common cause of intellectual disability, Down syndrome. Most common cause of intellectual disability, Down syndrome. Okay, genetic cause or hereditary cause, Fragile X syndrome. Genetic cause it is Fragile X syndrome because chromosomal Downs is a chromosomal cause. Genetic would be Fragile X syndrome. No issues with this. Now, so please remember, normal IQ is between 90 to 92. So normal IQ is between 90 to 109. सब इसी में fall होता है. Then borderline would be minus 20, 70 to 90. Borderline would be 70 to mild intellectual disability minus 20. 50 to, अब it is 50 to 69 ऐसा है. I'm just writing it. 50 to 70. Moderate it is minus 15. 35 to 50. 35 to 49. Exactly. ठीक है. Severe it is 15 to just a minute. 20 to 35. 20 to 35. And lastly, profound it is. Profound it is. कोई है क्या? Profound it is less than 20. ठीक है. So normal IQ is between 90 to borderline, mild, moderate, severe, profound. So you need to decrease 20, 20, 15, 15. ऐसे याद रखना. ठीक है. Normal याद रख लो and then you decrease it. Next, occupational health now, guys. So occupational health is associated with some profession that is causing some disease in the patient, right? In that specific workers, right? Sorry. So occupational health can be associated with anything. Excessive heat exposure in a patient can cause hyperpyrexia, heat stroke in the patient, okay? Anything. Excessive cold exposure like in a shoulder of Siachen glacier will cause frostbite or chilblains in that soldier. Okay, so or a soldier posted usually in like CSF soldiers who are standing in water for a long period of time can cause trench foot. All of these can be seen. Okay, but the most common ones are usually pneumoconiosis. Most common are pneumoconiosis. So it is an occupational lung disease. It is a occupational lung disease. It is due to exposure to some dust. It is due to exposure to some dust. And these particles, the most dangerous particle size is 0.5 to 3 micron. Most dangerous particle size is ये question था. Most dangerous particle size is 0.5 to 3 microns. That will go inside your lungs and damage your lungs. Okay. Pneumoconiosis, anybody? Which type of hypersensitivity? Type 4 hypersensitivity, because it is an example of hypersensitivity pneumonitis. Patho. Okay. Then if I talk about some pneumoconiosis and associated occupation and some important points. Jaldi se. Most common pneumoconiosis would be causing death is silicosis. Most common pneumoconiosis causing death is so silicosis. Silicosis is seen with which industry workers? It is seen with sandblasting industry. Sometimes also termed as rock blasting. Last time I had a stone blasting or rock blasting industry. And also seen in glass industry workers. Important point. Silicosis is most commonly associated with and chest X-ray of silicosis shows two important things. Which appear as snowstorm appearance. Which appear as and which calcification? Eggshell calcification. Which calcification? No issues with this. So most common pneumoconiosis, silicosis. Which industry workers? Sandblasting, rock or stone blasting and glass industry workers associated with tuberculosis. Second is anthracosis. Anthracosis is also called as coal workers pneumoconiosis. Anthracosis is also known as coal workers pneumoconiosis. So the occupation is associated with coal miners. So it is commonly seen in coal miners. And anthracosis is the important point. The complication of anthracosis would be progressive massive fibrosis. The complication of anthracosis would be progressive massive fibrosis. The lungs would get fibrosed completely. Okay. Whereas if it is associated with rheumatoid arthritis, then it will lead to Kaplan syndrome. When it is associated with rheumatoid arthritis, it will cause Kaplan syndrome. Asbestosis. Asbestos is due to exposure to asbestos fibers, right? And these asbestos fibers are seen in which industry? It is usually seen in cement industry or construction workers, even in cardboard industry as well. Okay, so cement or construction workers or cardboard industry. Now, a question which came earlier, recall question. Which is the most pathogenic fiber of asbestos? It is the anthocyte fiber or the straight fiber. Question the recall. Which is the most pathogenic fiber of asbestos? Straight fiber or the anthocyte fiber? Straight fiber or the anthocyte fiber? Anthocyte fiber is also known as the straight fiber. That will go deep inside the lungs and will cause damage. Okay? The most pathogenic is straight or anthocyte fiber of asbestos. It is seen in cement or construction industry workers. Important, all pneumoconiosis will damage the upper lobe. All pneumoconiosis will damage the upper lobe, except one, and that is asbestosis. Asbestosis damages the lower lobe. Asbestosis damages the lower lobe. Now important points about asbestosis. Asbestosis is associated with which cancer? Most common is bronchogenic adenocarcinoma. Most common is bronchogenic carcinoma bole ya adenocarcinoma bole. Most common is but most malignant या most specific is mesothelioma. Most specific is no issues with this. So most common cancer with asbestosis, adenocarcinoma. Most specific or most characteristic cancer with asbestosis, malignant mesothelioma. It is a pleura-based tumor. No issues. Moving further. Byssinosis. Byssinosis is due to exposure to the cotton fiber. It is due to exposure to the cotton fibers, right? And cotton fibers exposure is seen with which industry? Textile mills. It is seen in textile mill workers. It is seen with textile mill workers. And a feature, the patient will have chest tightness, but when he resumes the work, and therefore it is called as Monday chest tightness. Therefore, it is called as Monday chest tightness. Monday chest tightness and Monday disease is different. All of these things will be different. Only Monday chest tightness is associated with bicynosis. Bagasosis. Bagasosis is due to exposure to bagasse or molasses. It is due to exposure to bagasse or molasses. And what is bagasse or molasses? It is the sugarcane dust. What is bagasse or molasses? Sugarcane dust. Therefore, bagasosis is seen in which industry workers? Sugar mill workers. It is seen in which workers? Sugar mill workers. And a question from June. It is also seen in cardboard industry workers. It is also seen in cardboard industry workers. Why? Because this bagasse or molasses, the waste product of sugar, is used for production of cardboard. ठीक है, याद रखना. उसी से बनता है ना cardboard तुम्हारा. तो इसीलिए. So bagasosis is common in which workers? Sugar mill and cardboard industry and sugar mill and cardboard mill and no issues with this. And here, important thing to be remembered is bagasosis में the organism which causes the disease is known as thermoactinomyces. किस वजह से हो रहा है? Sugar cane. So also known as thermoactinomyces saccharine. Thermoactinomyces शक्कर से याद रख लो. ठीक है. तो bagasosis is caused by which organism? Bagasosis is caused by which organism? Thermoactinomyces saccharine. And important thing they will ask you, सब one liner क्या? Occupational health is important. Patho, PSM दोनों से question आते हैं. So thermoactinomyces saccharine is the organism, but the bagasse or the molasses dust, okay, the bagasse or the molasses dust, which usually, molasses dust, which usually is in the air to settle that bagasse or molasses, we use the chemical known as 2% propionic acid. So which chemical is sprayed over the bagasse or molasses? This was a recall question. Which chemical is sprayed over the bagasse or molasses to settle it down? Which chemical is used for settling down of bagasse or molasses? 2% propionic acid. Next one is farmer's lung. So farmer's lung is due to exposure to moldy hair. So definitely it would be seen in farmers, right? By the name it is evident. So it is usually due to exposure to the moldy hay. It is due to exposure to the moldy hay. And the organism responsible is, ये भी option आया था, Micropolyspora feni. Micropolyspora. So the organism responsible for farmer's lung is, the organism responsible for farmer's lung is, the organism responsible for farmer's lung is Micropolyspora feni. Pneumonia. Now some occupations can also lead to pneumonia. And one of the occupation is bird handling. One of the occupation is bird handling. Therefore, this type of pneumonia is also called as bird handler's pneumonia, or the other name given to this due to the organism which causes it. The organism which causes is known as, and anybody, Chlamydia psittaci. Chlamydia psittaci. And therefore, this bird handler's pneumonia is also called as psittacosis. Therefore, this bird handler's pneumonia is also called as psittacosis. ठीक है, कुछ अजीब सा आए तो ये मत होना, PSM ऐसा ही है. They can give you multiple things from multiple directions. PSM is such thing कि community से कुछ भी उठा के दे सकते हो तुम. So be ready for that. ठीक है. So pneumonia नहीं याद हो रहा, इसीलिए मैंने tables बनाया है. Stick these tables on your walls and keep revising these number of times. It would become easier for all of you. ठीक है. So pneumonia is seen with which occupation? Bird handling. Therefore, it is known as which type of pneumonia? Bird handler pneumonia. Due to the organism which causes it is known as Chlamydia psittaci, and therefore it is known as psittacosis. One important question: which fungal infection is caused due to pigeon dropping exposure? Pigeon dropping exposure की वजह से which fungal infection is caused in lungs? It completely resembles tuberculosis. जल्दी कोई तो. A disease resembling tuberculosis caused due to exposure to pigeon dropping or pigeon feather exposure. अरे लड़का. Fungal infection guys. Fungal infection. All dimorphic fungal disease. ठीक है चलो. All dimorphic fungal disease. जल्दी anybody. मेरे पास रखो. Shabash, all of you online. That is histoplasmosis. A TB resembling disease is known as histoplasmosis, and it is caused due to exposure to pigeon droppings or pigeon feather exposure. ये question था, important है. Pigeon dropping exposure causes a fungal infection known as histoplasmosis. It completely gives symptoms like TB in the patient. ठीक है? It is also known as which disease? ये नाम तो याद ही होगा. नहीं है यार? Darling. मैं बोला ना ये नाम तो याद ही होगा. Darling disease. Then next question. A painter presented with pallor, abdominal colic, wrist and foot drop. Diagnosis would be? So the diagnosis would be lead poisoning. Lead poisoning is also called as plumbism. Lead poisoning is also called as plumbism because lead is known as plumbum. Lead is known as plumbum. It is more common in which occupation? Painters. It is more common in which occupation? Painters. And therefore it is also termed as painter's colic. Therefore it is also termed as painter's colic because a painter presenting to you with abdominal colicky pain. Therefore, okay, please remember. What is this sign known as? Purplish or blue color discoloration of gums. These are known as the Burtonian lines. These are known as the Burtonian lines. So Burtonian lines are a feature of? Burtonian lines are a feature of? On peripheral blood smear, you will find small RBCs. That means a microcytic hypochromic anemia. Hemat kara hoga. If you haven't watched the hemat video, it is uploaded on app today. Okay, so microcytic hypochromic anemia. Along with these blue color dots in RBCs known as basophilic stippling. These are known as basophilic stippling. No issues with this. So important. Lead poisoning causes which type of anemia? Microcytic hypochromic anemia. And which is the feature on peripheral blood smear? Basophilic stippling. Blue colored lines on gums are known as Burtonian lines. What is the most common source of lead poisoning? Most common source of lead poisoning would be? Most common mode is inhalational. Most common source is either gasoline or petrol. Gasoline or petrol. So please remember, it is not the paint. It is the gasoline or petrol. And most common mode is usually inhalation. Okay? And it will also lead to wrist and foot drop in the patient. Okay? Abdominal colic to hoga hi. Important. Now, the most consistent and the earliest sign of lead poisoning would be, मैं FMTB खींच रहा हूँ. Most consistent, ये PSM का भी question हो सकता है. Most consistent or the earliest sign of lead poisoning, pallor. Most consistent or the earliest sign of lead poisoning is pallor. Please remember this. No issues with this, anybody? And what is the drug of choice for lead poisoning? Antidote? EDTA or D-penicillamine. EDTA or D-penicillamine. Shabash, all of you. Moving further. A worker under ESI Act was given 80% of wages for 2 years when he was diagnosed with TB. Under which scheme of ESI? So if I talk about ESI, first of all, this is the logo for your Employee State Insurance Corporation. Employee State Insurance full form bhi पूछ सकते हैं. Employee State Insurance Corporation. ठीक है? लिख दूं. And this Employee State Insurance Corporation was formed after the ESIC Act. Okay, this Employee State Insurance Corporation was formed after the ESIC Act of 1948. It was formed after the ESIC Act of 1948. ठीक है? ESI Act 1940 कुछ बुक्स देते हैं, 1948 में फाइनल ड्राफ्ट हुआ था. ठीक है? 1948. No issues with this. Now, according to this ESI Act, the factory workers will get some benefit or they will get some health benefits, to be specific. Okay, they will be treated for free in the ESI hospitals. But free तो ऐसे नहीं treat होगा. They need to pay something, and that is actually cut from their wages और उनकी salary से कटता है. ठीक है? But the beneficiaries of this ESI scheme would be only people working in a factory having a salary less than 21,000. Having a salary less than 21,000 per month. Okay, having a salary less than 21,000 per month. These are the beneficiaries of the ESI Act or ESI scheme. Important. Now, according to this, some paisa, like some money is also contributed by the employee and some by the employer. ठीक है? तो ये पूछा जाता है, how much money is contributed by the employee? Employee is the one who works over there. It is 0.75% of the wages, 0.75% of his salary or 0.75% of his wages. Whereas employer की अगर बात करो, जो काम करवा रहा है, It is 3.25%. 3.25% of the wages, making it a total of 4%. Making it a total of 4% of what? 4% of wages or the salary. 4% of his salary. So अगर उसकी salary 20,000 है, out of that 0.75% he will give, and 3.25% would be given by his owner or the employer. No issues with this. Jaldi say employee contribution, employee contribution, employer contribution, employer contribution 3.25. Don't forget it. याद रख लो, ठीक है? And if they ask you what is the center is to state ratio or contribution, center कितना देता है, state government कितना देती है? 7:1. Center is to state contribution is 7:1. No issues with this. So important, ठीक है? So what is now under this ESI Act? The people will get benefit, okay? Different benefits these people will get. Free healthcare in the ESIC hospitals तो है ही, but if they are not feeling well, they will get a holiday तो नहीं बोलेंगे, they will get a medical leave with some percent of wages, okay? So they will get a medical leave with some percent of wages. So here they are saying a patient was diagnosed with TB, which is a chronic disease, and therefore he was given a medical leave for 2 years with 80% of wages. This comes under extended sickness benefit. This comes under, so 80% wages for 2 years, 80% wages for 2 years, 80% wages for 2 years. A question, recall question now. 70% wages for a period of 91 days. 70% wages for a period of 91 days. This is known as sickness benefit. This is known as sickness benefit. Jaldi se, okay? So 70% wages for 91 days, 70% wages for 91 days, 80% wages for 2 years, 80% wages for 2 years, extended sickness benefit. Then in this, or for any, not only limited for the ESI Act, for any of the female worker who is working, okay? If she gets pregnant, she gets a maternal leave of how many weeks? She will get a maternal leave of 6 months, that is 26 weeks. How many weeks? 26 weeks. And on how much percent wages? 100% wages. कुछ काटा नहीं जाएगा. On 100% wages. Okay. So maternal leave is for how many weeks? 26 weeks. How many weeks? 26 weeks or 6 months. And how many percent wages? 100% wages. Okay. No issues with this. Important. If they ask you about enhanced sickness benefit, anybody? Enhanced sickness benefit is 100% wages are given, and that is usually for promoting sterilization. That is usually for promoting sterilization. Okay. So either vasectomy or tubectomy. Vasectomy or tubectomy. So after vasectomy, 7 days leave, tubectomy, 14 days leave on 100% wages. This is what is known as the enhanced sickness benefit. Okay. Yaad rakhna. No issues with this. Moving further. Jaldi say 3.25% wages from the employer, 0.75% wages from the employee. Center contribution 7, state contribution 1. Enhanced sickness benefit for sterilization. Okay, extended sickness benefit for how many years? On how much percent? 70% wages for 91 days is maternal leave for how many weeks? How many percent wages? Enhanced sickness benefit, how many percent wages? Shabash. ESI Act 1948, beneficiary less than, salary less than 21,000 per month. ESI done? ठीक है? यार direct benefit ESI में काम किया इसलिए बता रहा हूँ. Important ESI like please remember, direct benefit means a person getting a treatment from the ESIC hospital. But ESIC hospital का सबसे बड़ा center is बसेदारापुर दिल्ली. ठीक है? But over there we don't have any neurosurgical department. Now if the patient is sent to some other hospital, ठीक है? Patient को समझ ले हम आसपास पार्क hospital में भेज देते हैं. So we will send the patient to Park Hospital. Okay, so it is a private hospital, but it comes under the ESI Act. ठीक है? So here the patient would be treated. Okay, the person will have all neurosurgical procedures, CT, MRI, everything, and all जितना भी bill आता है वो किसके नाम पे फटेगा? तो ESI के नाम पे फटेगा. ठीक है? That is what is a indirect benefit. Direct benefit from their own hospital. Indirect benefit from an empaneled hospital. Okay, we used to send these people by preparing a P form, और वो P form accept होता है वहाँ पे जाके, तो all that is a different process altogether. इंटर्नशिप करोगे तो पता चल जाएगा वहां पे। कार्सिनोजन की अगर मैं बात करूं, नाउ UV radiation will lead to which cancer? UV radiation contains mainly, sir, it is due to UVB rays. Okay, it is mainly due to UVB rays, that is your sunlight. So excessive sunlight exposure can cause which cancer? Squamous cell cancer of skin. So most common occupational cancer is skin cancer. Most common occupational cancer is, this was the direct question, most common occupational cancer is skin cancer and is associated with ultraviolet radiation. Next, benzene exposure can lead to leukemia. Benzene exposure causes leukemias can also be caused due to exposure to radiation. Leukemias can also be caused due to exposure to all leukemias can be caused by exposure to radiation except one. CLL. All leukemias can be caused by exposure to radiation except one, and that is CLL. Important है, ये मैथ में कर रहा है. Next, PVC, polyvinyl chloride. Question, recall. Polyvinyl chloride. It causes angiosarcoma of PVC exposure causes. PVC exposure causes nitrogen or aniline causes. Nitrogen, aniline or benzene causes. Nitrogen, aniline or benzene causes. Benzene, leukemia. Benzene or nitrogen, aniline, bladder cancer. Wood dust or nickel causes nasal sinus carcinoma. Wood dust or nickel causes nasopharyngeal carcinoma is associated with wood dust exposure, but more commonly it is the nasal sinus carcinoma. And malignancy is most common in which sinus? Maxillary sinus. So more commonly maxillary sinus is associated with wood dust exposure or nickel exposure. So wood dust or nickel exposure causes nasal sinus carcinoma. Asbestos exposure, as we most common is, most specific is, no issues with this. Important. Aflatoxinosis causes hepatocellular carcinoma. Which industry workers? Groundnut industry workers. Which industry? Sabka favorite topic or fixed one question in every exam, maybe two at times. That is biomedical waste management or biomedical waste segregation. Okay? It comes under which act? Environment Protection Act. Under the Ministry of Environment and Forest. Ministry of Environment and Forest Ministry and Environment Protection Act. No issues with this. According to this, the hospital waste should be segregated into 5 major categories. Okay. So here we have four, and the 5th category would be black bag. The 5th category is the black bag, and this black bag will contain all the general waste. The black bag will contain all the general waste. Any wrappers, okay, all of these will go in the black bag. That is your general waste. Now, talking about yellow bag. क्या करना चाहते हो? Quiz खेलना चाहते हो या I shall tell you? Quiz? पक्का? All of you are fine with it? चलो. Yellow bag if I talk about, okay? So yellow bag में, red bag में, white bag में या blue bag में. ठीक है? Sorry. White. Please remember, yellow and red are bags. Yellow and red are bags. But white is a translucent container. White is a translucent container. Whereas blue is a box. Blue is a box. If blue is not in option, the second thing to be marked is a cardboard box. Blue is not in option, the other thing to be marked is a cardboard box. No issues with that. Now, jaldi bataoge tum. ठीक है? I'm throwing questions at you. All those online also participate. Jaldi se. So, by anatomical waste. Anatomical waste. Placenta. Amputated limb. Animal waste. Animal waste. Cotton waste. Dressings and bedding. Dressings and bedding. Rubber. Rubber. Plastic. Plastic. Thin plastic. One time use. Wo wrapper wala, that is in black. But other plastic. Red. Other plastics in. Cannulas. Cannulas. IV set. Catheters. Catheters किससे बने होते हैं? Rubber. Right. Therefore they will go in red. Glove. Stained glove. किसने बोला ये? किसने बोला? कोई नहीं बोला. Red gloves also go, according to the act, red gloves also, soiled waste or soiled gloves or the stained gloves also go in red bag itself, because the red bag content is first autoclaved. ठीक है, उसके बाद it is sent for disposal. So it is also treated first. Okay. So stained gloves are also going in. Stained or unstained gloves are going in. Stained or unstained gloves are going in. क्लिनिक्स में आओगे बहुत सारे लोग इसीलिए कंफ्यूज होते हैं, गाली खाते हैं फिर इन्फेक्शन कंट्रोल वालों, ठीक है. सो डोंट डू दैट. सो ग्लव्स विल गो इन. यूरिन बैग, फेस मास्क, हेड कैप, शू वियर, शू कवर्स, hazmat suit of PPE, yellow because it is contaminated. Whereas the gown in, if it is a plastic gown, it will go in red. If it is a plastic gown, it will go in red. No issues with this. याद रखना. Microbiological waste, culture plate, biochemical waste, liquid waste, contaminated paper, contaminated cloth, pathological waste, ascaris, shabash, syringes, white, syringes, needles, scalpel, blades, sharps, metallic ware, nails, scissors, metallic body implant, pacemakers. If it is metallic, blue, plastic, red, glove, ampules, blue, ampules, glass ampules na, blue, vaccine wires, broken glass, blue. No issues with this. Now talking about the disposal. सबको आता है ये, नहीं आता तो प्लीज टेल मी, ठीक है. Now talking about the disposal. Now yellow bag would be disposed of by the process known as, it is disposed of by, the other is plasma pyrolysis. The other one is plasma pyrolysis. What is the temperature of incineration of plasma pyrolysis? More than 1200 degrees Celsius. What is the temperature of incineration? Then red are all rubbers and plastics. That means recyclable waste. Red means recyclable waste, plastics and rubbers. Okay. But first, it would be either autoclaved, microwaved, or hydroclaved, and then it would be sent for recycling. If it does not go in recycling, आजकल गडकरी ने क्या कर दिया? It will go for road making. ठीक है, important. Next, sharps usually, scalpels, blades, all of that. Again, they are infected. Therefore, first they will be disinfected with autoclaving, microwaving, or hydroclaving, and then they will go for shredding. टुकड़े करेंगे उसके, ठीक है. Then they would be shredded, and then finally they will go for sharp pits. or landfill. No issues with this. Last, blue box things or cardboard box contents will be disposed of by. So it is metal or glass. It can be recycled. So again, it is a recyclable waste. Metal or glass recycle hota hai. So again, it is a recyclable waste. So again, it is infected. So autoclaved, microwaved, or hydroclaved. After that, it would be sent for recycling. If it does not go for recycling, then then for landfills. Okay? No issues with this. Jaldi se. Yellow bag is disposed of by temperature of incineration more than 1200 degrees Celsius. Red or recyclable waste goes for recycling and road making. But first it is disinfected. Then sharps are disposed of by shredding and sharp pit. Blue box content or cardboard box contents are recycled usually. ठीक है. Next, important एक दो चीजें जो क्वेश्चन आए हुए हैं बायोमेडिकल वेस्ट से. Apart from this, now please tell me, mercury would be disposed of by 3R. Okay, 3R for mercury. We will recollect, recycle, reuse. That is what is done with mercury in the thermometer. Then important, radioactive waste. Very good. Sea burial. Radioactive waste C burial, C में छोड़ा जाता है. No issues with this. Now if there is a blood stain, common सरकारी question of PSM, blood stains on the floor, it is disinfected with 1% sodium hypochlorite. It is disinfected with 1% sodium hypochlorite. Disinfected with 1% sodium hypochlorite. सरकारी है, याद रखो. No issues with this. Next, what is this machine for? It is the autoclave. It is autoclave. What is the temperature of autoclave? Temperature of autoclave is 121. What is the temperature of autoclave? 121 degrees Celsius. It is kept for how much time? It is kept for how much time? 15 to 30 minutes, minimum 15 minutes. Under how much pressure? 15 pounds square inch, 15 psi. How much pressure? What is the principle on which autoclave works? Steam under pressure. What is the principle of autoclaving? What is the principle of autoclaving? What is the principle of autoclaving? Steam under pressure. Now, important. इधर मेरे पास जगह नहीं है. You can write it. यहाँ पे लिखता हूँ मैं. What is the control organism for autoclaving? Geobacillus styrothermophilus. Geobacillus styrothermophilus. No issues with this. So what is the control organism for autoclaving? Geobacillus styrothermophilus. What is the control organism for autoclaving? पता है, मैंने रटा है, मुझे एग्जाम देना है, बट बोल दो थोड़ा बहुत. What is the control organism for autoclaving? Geobacillus styrothermophilus. No issues with this. Moving further with disaster management. Done with biomedical waste. याद रखना सब चीजें. Then disaster management, if I talk about, guys, here we do segregation of patient post disaster. It is known as triage. It is known as triage, not reverse triage. याद रखना, segregation of patients post disaster or categorization of patients post disaster is known as triage. Reverse triage मतलब क्या? Over there, the person with minor injuries will be given the highest priority, and the person with severe injuries will be given the least priority. Why? Because we need more man force. We need more man force in the field. That is usually done in cases of wars. That is usually done in cases of wars, and that is done with soldiers. So reverse triage is done with soldiers. Reverse triage is done with soldiers during wars. Okay, whereas triage is normally after any disaster. Disaster is when more than 30 people are requiring medical help at the same time. Okay, that is what is a disaster, right? If I talk about this, what is this? Disaster management cycle. So this is a disaster management cycle. So there are 4 phases of disaster. They usually ask you. Disaster impact से पहले कौन से दो? Disaster impact के बाद कौन से दो? So the 2 phases that come before disaster impact are mitigation and preparedness. Mitigation means to try to reduce the impact of the disaster. That is what is mitigation. And preparedness, to be ready for a disaster. For example, in Orissa, if there are multiple floods in that state, we will be ready for the floods. Okay, we will have our teams ready over there. Okay, so that is what is mitigation and preparedness. And after a disaster strikes, after a disaster impact, there would be response and recovery. Response and recovery and post disaster. Pre-disaster, which 2 phases? Mitigation and preparedness. So after a disaster strikes, ठीक है, तो कोई भी disaster आ गया, natural or man-made, any disaster if comes, then the first thing to be done is search and rescue, and the next is emergency relief. So in the 0 to 6 hours, the patient would be rescued from the position. Okay, and next from 6 to 24 hours, they will be given medical relief. Right? After 24 hours, all that immunization, rehabilitation things will start. Okay, after 24 hours, all the rehabilitation things will start. No issues with this? I hope so. Okay. Now, triage, if I talk about, important thing I want to ask you, segregation of patients post disaster is known as triage, but it is based on, 2 options दे रहा हूं. It is based on severity of injury or likelihood of survival. Severity of injury वाले हाथ उठाओ जल्दी. Likelihood of survival वाले, शाबाश, thank God. So it is likelihood of survival. Why? Just remember it. जिसने भी severity of injury पढ़ा है, एक बात समझ लो. Highest priority is given to red. Highest priority is given to red. But most severe injuries are seen with black. उनको क्यों least priority फिर? Severity की वजह से अगर होता तो it would have been black the highest priority and red the next priority. So it is dependent on the likelihood of survival. Please remember, this was a question which has been asked. Okay, so triage is dependent on likelihood of survival. कौन जिंदा रह सकता है? That would be our highest priority, right? So please remember, segregation of patient or triage is dependent on. According to triage, the highest priority is given to which category? Highest priority is given to. Highest priority is given to. Second highest is given to. High priority would be yellow. Yellow option में नहीं है तो. Yellow option में नहीं है तो. So second high priority would be yellow or blue or. Next priority would be. Next priority would be. Low priority would be to the green category, and the least priority would be. Least priority would be black. Now, jaldi se. So red category में the patient who will require immediate resuscitation, who requires immediate resuscitation or limb or life-saving surgery within a period of red category. Then a person requiring limb or life-saving surgery within a period of 6 to 24 hours is included in which category? Yellow or blue. Yellow or blue. Next, a person who is roaming here and there, ambulatory patient, having only minor injuries is included in minor injuries, ambulatory patient, 6 to 24 hour surgery, yellow or blue. 6 to 24 hour surgery, immediate resuscitation, 6 hour surgery, and dead patient, moribund patient, and last जो एग्जाम में आया था और लोग याद नहीं करते, दो पेशेंट बचाए नहीं जा सकते, unsalvageable patient. Which patient? Unsalvageable patient. They also come in black priority. Highest priority, which category? Least priority, which category? Reverse triage is seen in war. Cold chain is seen for vaccine transportation. Reverse cold chain is seen for sample of polio. Okay, sample of polio, like polio stool sample from the collection site till the lab. Okay, that is what is the reverse cold chain. Temperature of reverse cold chain is 2 to 8 degrees Celsius. Shabash. Next, what is this image for? National Disaster Response Force. This is a National Disaster Response Force. All of them are hand in hand. So these are all our forces, CISF, ITBP, all of these forces, border security forces, all of them come to rescue the people who are struck in disaster. Important, that is your National Disaster Response Force. Logo hai uska. National Disaster Response Force comes under the National Disaster Management Authority. It comes under the National Disaster Management Authority. The chairperson of National Disaster Management Authority is Home Minister or Prime Minister? The chairperson of NDMA is? Chairperson of NDMA is? But the nodal ministry of NDMA is? So nodal ministry for disaster is? Home Ministry, Amit Shah. Okay? Nodal ministry? Home Ministry. Chairperson? Prime Minister. Nodal center from where all the rehabilitation and help will be given. This was the question. Nodal center, nodal officer, district magistrate या collector. Nodal officer, district magistrate or district collector. No issues with this. ये हो गया तुम्हारा disaster management. Okay, so disaster management में rehabilitation is given at which level? Rehabilitation is done at which level? District level. So the nodal center would be, nodal officer would be district magistrate. Chairperson of NDMA, nodal ministry for NDMA, home ministry. Most common disaster बताओ. Most common disasters are usually aquatic disasters that are floods. Okay, most common are floods. ठीक है? Most dangerous disaster till date. Most dangerous man-made disaster till date. It was Bhopal gas tragedy. Due to exposure to methyl isocyanide. Due to exposure to Methyl isocyanate. This was a question. Bhopal gas tragedy was due to exposure to which chemical? Methyl isocyanate. And Bhopal gas tragedy is the known worst man-made disaster. It is the most dangerous disaster occurred on 3rd December 1984. 3rd December 1984. 86 में क्या हुआ था? Chernobyl tragedy. And Chernobyl tragedy was due to exposure to cis. Chernobyl tragedy was due to exposure to cis. Cesium, iodine, strontium. Cis exposure. Epidemiology now. Epidemiology is actually the study of disease based on 3 parameters or 3 parameters usually. And these 3 parameters are: first is distribution of the disease. That means disease is more prevalent in time, place, or person. In which place it is more prevalent, in which sex it is more prevalent, in which age group it is more prevalent. That is the study of disease based on the distribution. Study of disease based on the determinant or the cause of the disease. And lastly, study of disease based on the frequency of the disease. So distribution, determinant, and frequency of the disease. Out of this, the most important is determinant of the disease. Okay? So that is what is epidemiology. And the father of epidemiology was? So he is John Snow. The father of epidemiology was? Father of epidemiology was? Father of modern epidemiology was? Father of modern epidemiology also? Father of public health? So John Snow worked on which disease? Cholera. And therefore the father of public health is? Father of public health is? Father of medicine is? Hippocrates. Okay, important. Whereas National Institute of Epidemiology is located in? National Institute of Epidemiology is located in? National Institute of Epidemiology is located in? Chennai. Okay, National Institute of Epidemiology is located in? Chennai. Okay, no issues with this? Okay, no issues with this one-liner. Now starting with epidemiology. Okay? So if I talk about distribution of a disease, guys. So as I told you, distribution of the disease would be seen in time, place, person. Right? If I talk about some diseases, okay? I'm asking you randomly again a quiz. Jaldi se. Okay? If I talk about time, some diseases are more prevalent in some seasons. Right? Respiratory infections which spread via respiratory droplets like measles are common in winter season. Measles are common in rubella, winter. Mumps, winter season. Okay, all of these are winter season. Influenza does not have a time distribution. It can occur throughout the year, more commonly in winter. Asthma, winter. Asthma, hay fever, winter. Due to pollen grain, na? So hay fever also winter. Then if I talk about place, right? So Kala Azar is more prevalent in the states of Bihar, Jharkhand, Uttar Pradesh and West Bengal. Bihar, Jharkhand, Uttar Pradesh and West Bengal. Kala Azar. What is the vector for Kala Azar in sandfly? Which species of sandfly? Phlebotomous species. Which species? Phlebotomous species. KFD is more prevalent in the state of Karnataka because it arises from the Casanur forest disease. The vector for KFD in India is? It is hard tick. Outside India it is soft tick. India के लोग कैसे होते हैं? Hard. Therefore hard tick. Hemophysalis species. ठीक है? No issues with this. Next, Japanese encephalitis is more prevalent in the state of East Uttar Pradesh and West Bengal. East Uttar Pradesh and West Bengal. No issues with JE. याद रख लेना. HIV is more prevalent in the states of Maharashtra, Manipur, Mizoram, Tamil Nadu, Andhra Pradesh. Okay, Maharashtra, Andhra Pradesh, Mizoram, Manipur. Shakti nazar se mat dekho. ठीक है? ठीक है. Next, if I talk about person distribution, ठीक है? So important personal distribution can be dependent on the age or on the sex. So which diseases are prevalent in children? It can be rheumatic heart disease, which is more prevalent in the age group of 5 to 15. Rheumatic heart disease more common in 5 to 15. Japanese encephalitis, 15 years of age. Japanese encephalitis till 15 years of age. Polio till. Let's skip that part now. ठीक है? फिलहाल मैं दिल्ली से हूँ. ठीक है, चलो. So मैं क्या बोल रहा था? हाँ. Come back to the topic, guys. Mumps is more common in which age group? 5 to 9 years of age group. Okay. So one thing is wrong, but the maximum tax paying population stays in Maharashtra. Okay. So चलो जल्दी आगे जल्दी आगे 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 जल्दी से mumps is more prevalent in 5 to 9 years of age group, that is school going age group. Rubella is more common in children usually like neonates वगैरह. ठीक है, अभी तो है नहीं ज्यादा. Next, chickenpox is more prevalent in 5 to 9 years of age group, again school going age group. Measles is more common in 6 months till 3 years. 6 months till 3 years. 6 months से पहले measles क्यों नहीं होता? Shabash. There is vertical transmission of antibodies from mother which stays till 6 months. After that, the risk of measles increases and therefore the first dose of measles is given at 9 months. Therefore, it is given at 9 months. No issues with this? Done? Or sex distribution. Diabetes is more common in? Diabetes is more common in males. मीठा कौन खाता ज़्यादा? Male. Like life expectancy किसकी ज़्यादा होती है? Females. Therefore, hypertension and cataracts are more common in females. No issues with this? Diabetes, mellitus or any non-communicable diseases like CAD are more prevalent after the age of 40 to 50 years. No issues. That is what is distribution. आगे बढ़ रहा हूँ मैं. Which is the best epidemiological study design? Shabash. It is meta-analysis. The best epidemiological study design is? The best epidemiological study design is? Followed by randomized control trial. Followed by randomized control trial. Followed by which cohort? Retrospective or prospective first? Retrospective cohort. Followed by retrospective cohort. Followed by prospective cohort. Followed by prospective cohort. Followed by case control. Followed by case control. Followed by cross-sectional. Followed by cross-sectional. Followed by ecological. No issues with this? Jaldi se. So best epidemiological study design is followed by followed by followed by followed by case control, followed by cross-sectional, followed by ecological. So the least preferred epidemiological study design is ecological and the most preferred is meta-analysis. ठीक है, अगर meta-analysis option में नहीं है तो RCT, that is your randomized control trial. Now if I explain you, please remember the epidemiological study design, it is classified into two groups. Either these are observational studies or interventional studies. Observational studies can be of two types, descriptive studies or analytical studies. So descriptive studies may we form a hypothesis. So hypothesis is formulated in the descriptive studies, which are in relation to time, place and person. Then comes the analytical studies, where we will test the hypothesis. Whatever hypothesis we have made, is it true or not? We will, hypothesis testing is done in the analytical studies. And the four analytical studies that we have are cohort, case control, cross-sectional and ecological. Next comes the interventional studies, which are for hypothesis confirmation. They are for hypothesis confirmation. And these are studies, randomized control trial, clinical trial, field trials or community trials. ठीक है? No issues with this now. याद रखना. Hypothesis testing in hypothesis testing in analytical studies. Hypothesis testing in hypothesis formulation in descriptive. Hypothesis formulation in and hypothesis confirmation in interventional. Hypothesis confirmation in interventional studies. ठीक है? Now, if I make a difference between the best two studies of epidemiological analytical study design, that is cohort and case control. So first of all, cohort ka direction is from forward looking. Cohort it is forward. Cohort it is. Therefore, it is also known as forward looking study. Also known as prospective study. Also known as prospective study. Case control, on the other hand, is a backward looking study. Case control is a backward looking study. Case control is a backward looking study. Okay, important. Also known as retrospective study. Important. Next now. जल्दी से तुम मुझे बताओ कि क्या है, ठीक है? Once we go from risk factor to disease, exposure to outcome, or from risk factor to disease, exposure to outcome, or cause to effect study is known as cohort study. Whereas ulta, outcome to exposure, effect to cause, or disease to risk factor is all case control study. No issues with this, anybody? Now, TROHOC study इसको बोलते हैं. TROHOC is just reverse of cohort, so it is the name for case control study. So case control study is also known as the TROHOC study. ठीक है? So this is just a reverse TROHOC study. ठीक है? TROHOC study. No issues with this. उल्टा नाम है वो केस कंट्रोल का, बस कोहॉर्ट का, बस दिमाग चलाते फालतू. नेक्स्ट फॉलोअप स्टडी है. फॉलोअप किसमें लोगे? फ्रॉम रिस्क फैक्टर यू आर स्टार्टिंग टिल डिसीज यू आर वेटिंग. कोहॉर्ट स्टडी. तो फॉलोअप स्टडी है. फॉलोअप स्टडी है. इन विच स्टडी यू कैलकुलेट इंसिडेंस. Cohort. Incidence is calculated in. Incidence is calculated in. Therefore, cohort study is also known as incidence study. Therefore, cohort study is also known as incidence study. No issues with this. Important. Next, if I talk about the duration, duration is more for, and therefore it is a expensive study. Whereas duration is less for, and therefore it is a inexpensive study or a cheaper study. Bias seen in cohort study is known as. So important. एक फंडा बता रहा हूँ. Now, if we are testing, that means we formulated a hypothesis, okay, that human papilloma virus causes cervical cancer in a female. ठीक है? So human papilloma virus becomes a risk factor. Cervical cancer becomes the disease. ठीक है? So now we are studying how much association is there between human papilloma virus and cervical cancer. So we took in 2010, we took almost 100 cases of HPV infected individuals and 100 cases of non-HPV infected females. ठीक है? 100 cases of HPV infected females, 100 of non-HPV infected females. Okay? That means one exposed group and one non-exposed group. We studied them for almost 12 years. And now in 2022, we are trying to check the incidence of cervical cancer in both these groups. Okay? So for example, out of the 100 exposed population, 80 developed cervical cancer. Whereas out of the 100 non-exposed population, 20 developed cervical cancer. Okay? So we had to take follow-up after every 2 years in this patient. Hua nahi, pap smears, HPV DNA should be done. Cervical cancer biopsy should be done. Okay? So with this, we were trying to take a follow-up. Therefore, cohort is known as a follow-up study. And as we started from 2010 and went till 2022, so it is a forward-looking study or a prospective study. हर साल हमें पता चलेगा कि what is the new number of cases, therefore incidence can be calculated. On the other hand, if I talk about case control, guys, 2022, I am going to a hospital. I am taking 100 patients of cervical cancer and 100 normal patients, 100 non-exposed patients. ठीक है? So the 100 patients are known as cases. 100 patients are known as cases. Whereas the 100 non-infected population or non-affected population is known as controls. Those are known as control group. Again, two groups. So please remember, in any epidemiological study design, for better results, you need to take minimum 2 groups. Minimum how many groups? 2 groups should be taken. Okay. Whereas the ideal ratio of case control study, cases is to control is, ideal is 1:4. Ideal is 1:4. That means 1 case is to 4 control group should be there. But the minimum would be 1:1. Minimum group should be 1:1. एक case, एक control group होना चाहिए, right? Now I am taking these 100 exposed and 100 non-exposed people. That means 100 deceased population and 100 non-deceased population, and I am looking backward. I am asking them their history in how many of you were infected with HPV previously, right? So here I am taking the history. So I am going in the backward direction. Therefore, it is known as a backward-looking study or a retrospective study. That is what is your case control study. Done difference. समझ में आ गया example? Now. So bias, please remember in cohort study what can happen? Some people will fall out of the study. That means some people might have got treatment for their HPV infection. Okay, might have got their treatment for HPV infection. या फिर their HPV infection was not diagnosed, or they changed their behavior. Like the classical case of smoking and lung cancer. Some people left smoking in between only. Okay, so that will alter the study results. That will affect the study results, and that is what is the bias. So any factor which will affect or will alter the study result is called as the bias. So here the bias which is seen in cohort study due to altering the behavior of a subject is known as the Hawthorne bias. It is known as the Hawthorne bias. Whereas in case control study, the patient was not able to recall where he had a HPV infection or not. So this is known as a recall bias. So recall bias is seen in Hawthorne bias is seen in study subjects altering their behavior is known as Hawthorne bias. Study subjects changing their behavior is known as Hawthorne bias. And study subjects forgetting their history is known as. No issues with this. Strength of association in cohort study is calculated by. So as I told you, in cohort study, we can calculate incidence, and therefore the strength of association would be calculated by relative risk. Strength of association in cohort is calculated by. We can even use attributable risk or population attributable risk. Okay? But the best measure for calculating the strength of association in cohort is, whereas the strength of association in case control is calculated by, also known as the cross product ratio or the odds ratio, AD upon B. Rare diseases के लिए we will use, for rare diseases we will use cohort or case control. Cohort में क्या होगा, if rare diseases के लिए तुम बोलोगे rare disease मुझे treatment नहीं पता, I don't know the treatment for this disease, but then also if I want to study मैं इसको risk में डालूंगा. ठीक है, तुम्हें treatment भी नहीं पता, COVID का treatment नहीं पता था, and if you study cohort in such a patient, like when you don't know a treatment for rare diseases, the patient might die, and that can create ethical problems. Okay, that is why rare diseases may we generally use case control study. The patients who are already having the disease, we will just ask them their history. Okay, multiple causes can be studied with. Cohort. Okay, multiple causes can be studied with case control. Multiple causes can be studied with case control. Multiple outcomes can be studied with. तुमने बस स्मोकिंग देख रहे हो, बट बाद में जाके उसको लंग कैंसर भी हो और 2-4 डिसीजेस भी हुए, तो मल्टीपल आउटकम. नो इश्यूज. शैल आई मूव फर्दर? आगे बढ़ते हैं. A RCT, randomized control trial, was planned. What will be the unit of study? In unit of study for randomized control trial would be, Shabash, it is the patient. Please remember, it is a patient or a case. For randomized control, the unit of study would be a patient or a unit of study for RCT would be. This was the recall question and सबने गलतियां करी. Unit of study for RCT would be patient. Whereas if I talk about analytical study designs now, please remember the unit of study for cohort, unit of study for case control, unit of study for cross-sectional. For all of these, it would be a individual. Whereas the unit of study for ecological would be, and therefore it will lead to ecological policy. ठीक है, तो याद रखना. So, unit of study I'm asking जल्दी से. Cohort, RCT, case control, ecological, and this cross-sectional, इंडिविजुअल. ठीक है, याद रखना. एक डेल्टा टेक्निक भी आई थी, वो तो बहुत रेयर क्वेश्चन था, अगस्त में मजे लेने के लिए डाला था. And such questions will come in PSM. Don't worry about these 3 to 4 questions. Okay, that would be fine. Next, here you can see a study design. ये images आ सकती है. They can give you such a study design where from sample population we have exposed and non-exposed group, and then we are looking for cases, non-cases, cases, non-cases. So, what is this type of a study design called as? It is called as a. जल्दी बोलो, मैं दे रहा हूं ऑप्शन. हाथ उठाने. ऑप्शन ए कोहॉर्ट, ऑप्शन बी केस कंट्रोल, ऑप्शन सी क्रॉस सेक्शनल, ऑप्शन डी इकोलॉजिकल, एरोस दिख रहे हैं तुम्हें कहीं भी? Did you see anywhere arrows? So it is not a longitudinal study, it is a cross-sectional study design. Cross-sectional study design, it is done at a point of time. It is done at a particular point of time. So now in 2022, I take like how many patients are there for cervical cancer and how many number of patients are infected with HPV. Okay, that is what is a cross-sectional study design. I will study the disease and the risk factor at a particular point of time in the population. ठीक है, याद रखना. The unit of study is individual only, but I will study it in a population. No issues with that. Now, if I am getting a total number of cases in the population for a particular disease, it is known as what? Total number of cases for a particular disease. It is known as prevalence, and therefore cross-sectional study design is also known as prevalence study. Therefore, cross-sectional study design is also known as prevalence study. Also, it is taken at a particular point of time, so it is known as a snapshot study. Therefore, it is also known as a snapshot study. No issues with this. If arrows are not seen, if arrows hota in forward direction, I would have said it is a cohort study. If arrows were there in backward direction, I would have said it is a case control study. But no arrows, it is a cross-sectional snapshot or a prevalence study. Okay, no issues with this. So which parameter is calculated in cross-sectional? Prevalence. Incidence is calculated in cohort. No issues with this? I hope so. Okay. And ecological study would be something like nutritional surveys which are conducted. Okay. A cohort study. Question में दिक्कत आती है लोगों ने बोला, so I have included question. A cohort study was conducted for breast cancer, and it was found that female sex is related to breast cancer and the risk factor of breast cancer, which is OCP, oral contraceptive pill intake. What is the best method to overcome this? First of all, what is this funda? Tell me. This factor, okay, this factor which is related to the breast cancer, that is disease, as well as it is related to the risk factor, that is OCP intake. So a factor which is related to the exposure as well as the outcome. It is the confounding factor. Okay. So the factor which is related to disease as well as risk factor or exposure as well as outcome, it is known as confounding factor. Okay. Please remember. So factor related to disease and outcome is disease and risk factor is exposure and outcome is confounding. And what is the most common method to overcome confounding? All of these are one-liners. So it is matching. The most common method to overcome confounding is matching. Okay, that means, please remember, here if I say breast cancer is more common in females and OCP intake is also associated with females. And if in one group, I only take females, other group only males. So ये गलत results देगा मुझे, it will yield me like abnormal results, and that is what is known as the confounding factor. Okay, so here the confounding factor should be distributed equally in both the groups. Female should be 50% in both the groups. Okay, that is how a confounding factor is distributed, and that is done by matching most commonly. But if I ask you, the best thing to remove confounding would be stratified randomization. The best thing to remove confounding would be the best thing to remove confounding would be the best method to remove confounding is stratified randomization. Option में नहीं है तो randomization. And if that is also not an option, then matching. If that is also not an option, then matching. So the best method to remove confounding is stratified randomization. Best method to remove confounding is most common method to remove confounding is matching. No issues with this, anybody? Now, so this was about the confounding factor. But as I told you, there are some important biases also. Bias, it can be a subject bias like Hawthorne or recall bias. It can be an investigator bias when he is giving more time to interviewing a case as compared to a control. That is what is called as an interviewer bias. Okay, it is an investigatory bias. And analyzer bias when there would be some calculation error. So these types of biases are seen. To overcome these biases, what is the technique used? For overcoming biases, we use blinding. Overcoming biases, we use if subject is blind, it is called as, if only subject is blind, it is called as single blinding. If subject and investigator are blind, it is called as, if subject and investigator both are blind, it is called as subject, investigator, analyzer, both, all of them are blind. It is called as triple blinding. The best blinding would be most common blinding is important bias एक पूछ रहा हूं मैं now. In 2020, there was no pulmonary medicine department in a hospital, and therefore the number of cases in OPD was 10. But now in 2022, the number of cases have increased to almost 50. Okay, and the investigator is not aware that pulmonary medicine department has opened. A super specialty has opened in the hospital now, and that is the reason why the number of pulmonary cases are increasing, like COPD cases are increasing. He did not know कि पहले pulmonary medicine department नहीं था, अभी है. He did not know that. So he directly interpreted the results क्या कि अभी COPD का incidence बहुत ज़्यादा बढ़ गया. But that was not true. It was only because of the fact, because due to different hospital admission rate. Different hospital, yes, this was a one-liner. Different hospital admission rate will lead to which bias? It will lead to a Burkesonian bias. Different hospital admission rate will lead to a Burkesonian bias. So Burkesonian bias is due to different hospital admission rate. Different hospital admission rate. This was a one-liner recall question. No issues with this, anybody? Moving further. In a study, doctor wants to check incidence of deafness in a factory workers after sound exposure of 5 years between exposed and non-exposed groups. Which study design is used? So first of all, first thing, they told you that the doctor wants to check deafness in factory workers after a sound exposure of 5 years. So that means he will go from now onwards till the next 5 years. It is a forward-looking study. So definitely cohort नहीं समझ में आ रहा, incidence calculate करने के लिए बोला है, and that is calculated only and only with cohort study. So the straight away answer would be, so this was a December question, it is a cohort study. It is a cohort study. So if they ask you to calculate incidence, relative risk, population attributable risk or attributable risk, answer would be straight away cohort study. If they ask you for odds ratio, then the answer would be case control study. No issues with this. Yaad rakhna. If it is a forward looking, the doctor is starting the study now, and after 5 years of exposure, he will calculate the incidence. That is what is a cohort study or a forward looking study. No issues with this. I hope so. Okay. Next, if I say this, that means multiple risk factors are associated with each other. Okay. So stress, alcoholism, smoking, all are associated with each other, and jiski wajah se the patient develops coronary artery disease. So this forms a web of causation. So this is known as the web of causation. This is known as the web of causation, and web of causation was given by McMahon and Pug. McMahon and web of causation was given by multifactorial disease theory. Multifactorial disease causation theory was given by, very good. Multifactorial disease causation theory was given by Pat and Crawford. Multifactorial disease causation theory was given by web of causation was given by theory of spontaneous generation. मतलब disease ऐसे ही होता है कुछ कहे बिना. Aristotle, the oldest theory was given by Aristotle, known as theory of spontaneous generation. Germ theory of disease, this is important. Germ theory of disease. Who was with microbiology? Louis Pasteur. So germ theory of disease was given by Louis Pasteur. No issues with this, anybody? Next, if I talk about this, here we have host, agent, and environment. Okay, this is known as the epidemiological triad. All of them are related to each other. Agent, host, and environment. Then if I say host, agent, and environment in relation to time, then it is called as epidemiological triangle. And if I change the agent by causative factors and environment, along with environment, I add psychological factors, social factors, genetic factors, nutritional factors. Then it becomes a advanced epidemiological triangle. No issues with this. Moving further, talking about clinical and preclinical trials. So these are usually done for a new drug in the market. RCT can be done. What is the heart of RCT, anybody? Heart of randomized control trial is randomization. Heart of RCT is ये one liner है. Heart of RCT is randomization. And if we do randomization, each study subject has an equal and known chance to go in either of the groups. Okay, each study subject, हर एक स्टडी सब्जेक्ट का उतना ही चांस बनेगा इस ग्रुप में जाने का या इस ग्रुप में जाने का. 50% इस ग्रुप में जा सकता है, 50% इस ग्रुप में जा सकता है. That is what is randomization, and therefore randomization overcomes the confounding as well as the biases. ठीक है, no issues with this. याद रखना. If I talk about clinical trials, guys, preclinical trials are done in phase 0. Phase 0 is done in healthy human volunteers. Phase 0 is done in healthy human volunteers. And what is done? Phase 0 done for? Phase 0 is done for because giving the therapeutic dose of a drug can be harmful. So therefore, we only give 1/10 of the dose. That is known as micro dosing. So micro dosing is phase Microdosing is phase 0 is phase 1. It is also done on healthy human volunteers. And what is assessed in phase 1? We assess the safety of a drug. Sometimes they also give non-toxicity of a drug. And second is maximum tolerable dose. So maximum tolerable dose is assessed in. Safety is assessed in. Non-toxicity is assessed in. Phase 1 में क्या-क्या assess करते हैं? Safety and maximum tolerable dose. Phase 2 is the first phase where we take patients. Phase 2 is the first phase where we take patients, 20 to 200 usually. And phase 3 में also, phase 4 में also. So phase 3 में 5,000 to 50,000 तक जा सकते हैं. 500 to 5,000 is the usual thing. And phase 4 is the patients. ठीक है again. Phase 4, phase 2 onwards we will take. So which is the first phase where we will take patients? Which is the first phase where we will take patients? No issues with this. Now phase 2 is done for safety done. Phase 2 is done for efficacy. Drug kitni effective है new drug. Phase 3 is done for comparison with the old drug or the existing drug. Phase 3 is done for comparison with the old drug or existing drug. And phase 4 is done for post-marketing surveillance. Phase 4 is done for post-marketing surveillance. Surveillance means monitoring of the drug. ठीक है? For any long-term or rare side effects. ठीक है? No issues with this. Now answer my question. जल्दी से. Animals are taken into study in. Healthy human volunteers phase 0 and 1. Patients onward phase 2. Safety is assessed in. Maximum tolerable dose in. Non-toxicity in. Microdosing in. Comparison with existing drug. Efficacy in phase. Post-marketing surveillance. Long and rare side effects. 4. After which phase the drug goes into market? So the drug goes into market after phase. Which phase has the highest chance of failure? क्योंकि efficacious ही नहीं होंगी. Which is the most important phase? Phase 3. The most important phase is RCT is done in. No issues with this. Moving further. A cohort study was conducted to find association between nitrosamines and gastric cancer. I hope all of you are quite aware. Refrigerated foods or fermented foods have high amount of nitrosamines, and they can lead to gastric cancer, more prevalent in the country of Japan. Okay? Out of 200 people exposed, 120 developed gastric cancer. Out of 200 non-exposed population, 10 develop gastric cancer. Calculate the relative risk and attributable risk. So, सबसे पहले तो we will divide this in a table. First of all, on upper side it goes the disease. Either it is present or absent. On side it goes the risk factor. Either it is present or absent. So, jaldi se risk factor is nitrosamines. Disease is gastric cancer. Okay? So how many people were having the risk factor and developed the disease? 120. Okay, out of the 200 exposed, 120 were having the risk factor and they also developed the disease. How many did not have a risk factor but then also developed the disease? 10. Okay, 10 were belonging to the non-exposed group, then also developed the disease. Then how many of them were having the risk factor but did not develop the disease? 200 minus 120, 80. How many of them were not having the risk factor and not developed the disease? 190. No issues with this. So इसी को क्या बोलेंगे जल्दी से? True positives would be 120. Having risk factor, having disease. Those are true positives. ठीक है? ये usually screening test के इसमें बोला जाता है, but I am telling you over here. ठीक है? True negatives does not have risk factor, does not have disease. 190 over here. Okay? So this is written as A. This is written as B, C, and D. No issues with this. So here we don't need to calculate the odds ratio, which is usually AD upon BC. Okay, here we need to calculate the relative risk because it is a cohort study. So, right. So here, if I calculate the relative risk, what is the formula for relative risk? Incidence in exposed upon incidence in exposed upon incidence in non-exposed. Okay. What is incidence in exposed over here? Incidence in exposed means out of the total exposed population, how many develop the disease? Okay. So 120 develop the disease out of total exposed, that is 200. Incidence in non-exposed, that means how many develop the disease in non-exposed population? 10 develop the disease out of the 200 non-exposed population. ठीक है, फंडा समझ गए? Now calculated कितना आ रहा है? It is usually 12. Okay, so that means how to interpret the result? Nitrosamine intake is associated with 12 times higher risk to cause gastric cancer. Nitrosamine intake is associated with 12 times higher risk to cause gastric cancer. If I talk about relative risk or odds ratio, guys, please remember these are to calculate the strength of association between the risk factor and the disease. If the value of relative risk or odds ratio is less than 1, that is suggestive of negative association or inverse association. That is suggestive of negative association or inverse association. Means the risk factor is protective for the disease. For example, HIV and condoms ले लो, ठीक है? So condom use is associated with HIV infection. The relative risk would be less than 1. Okay, the relative risk would be less than 1. That means condom is not a risk factor for HIV, rather it is a protective factor for HIV. If relative risk is equal to 1, then no association. That means it is not associated with the disease. And if the relative risk or odds ratio is more than 1, it means positive association. It means positive association. That means the risk factor is associated with disease. And here the risk factor of nitrosamine is 12 times higher, like it is associated with disease, and it will lead to 12 times higher risk of gastric cancer than the non-exposed population. No issues with this. They also asked you to calculate attributable risk. What is the formula of attributable risk? Incidence in exposed upon incidence in, minus incidence in non-exposed upon incidence in exposed into 100. Okay, so here it is a proportion. It's into 100 because we will calculate the percentage. So incidence in exposed kitna tha? 120 upon 200. Incidence in non-exposed kitna tha? 10 upon 200. Upon incidence in exposed kitna tha? 120 upon 200. Calculate karo, kuch 66 वगैरह आएगा. It is 90% आ रहा है. ठीक है. So it is around 90%. ठीक है. Around 90%. 92 होगा. I think so. Okay. It would be 92%. So the attributable risk in the patient would be 92%. What is the formula for attributable risk? Incidence in exposed minus incidence in non-exposed upon incidence in exposed. No issues with this. And last, I will only give you the formula. ये पूछते नहीं है calculate करने के लिए. Population attributable risk. Incidence total minus incidence in exposed upon incidence of total. ठीक है? No, sorry, incidence in non-exposed. Incidence in non-exposed. So total incidence minus incidence in non-exposed upon total incidence. That is what is population attributable risk. ठीक है? No issues with this now. ठीक है? कोई दिक्कत नहीं. Then if I say एक example जल्दी से study design है. Okay? So guys, in 2022, I am collecting the data from a hospital of HPV infected patient. Okay, I am collecting the data patient of HPV infected, 100 HPV infected, 100 normal patients. I collected the data from 2010 from the hospital. Now in 2022, I am tracking those patients and I am asking how many of them have developed cervical cancer. So this is which type of study design? The more specific answer is retrospective cohort. Why retrospective? Because I did not follow the patient. I just got the history of the patient. Okay, that is what is a retrospective cohort study. Preventive ops and pedia. जल्दी important सबको आता है. गायनी से क्या क्वेश्चन है? सब जल्दी एक्टिव होना चाहिए. Antenatal visit. That means a patient who is pregnant will go to the hospital. Pregnant patient going to the hospital. That is what is antenatal visit. Recommended antenatal visits are Recommended antenatal visits are 13 to 14. Once every month till the first 7 months. Once every month till the first 7 months. Twice every month for the twice every month for the, and from 9th month onwards once every, from 9th month onwards once every, so 9 months till delivery. So total of 13 to 14 visits. So what are the recommended number of antenatal visits? Recommended antenatal visits पहले 7 month में once every month, in 8th month twice a month, in 9 month onward once every week. ठीक है. Next, if I talk about minimum antenatal visits, what would be your answer? So according to Indian scenario, it is 4. Minimum antenatal visits था, minimum antenatal visits था, तो अभी तक 3 लेके बैठे हैं दिमाग में बैठा, भूल जाओ. Minimum antenatal visits था 4. Minimum WHO antenatal visits are, minimum WHO antenatal visits are, now they have recommended 8. Previously उनका भी 4 ही था. No issues with this now. If I talk about postnatal visits, that means a healthcare worker will visit the home of the patient. Healthcare worker going to the home of the patient. That is what is the postnatal visit. She usually goes for assessment of the health of the newborn and the mother. Okay? So, important, please tell me, these postnatal visits will end on which day? It will end on the 42nd day. It will end on the 42nd day. Why? Because maternal death would be, definition क्या उसकी? Death of a mother during pregnancy, during labor, during delivery, or until 42 days post delivery. That is why for assessment, postpartum hemorrhage के लिए the patient the healthcare worker will visit the patient for at least maximum 42 days. Okay? So now postnatal visits can be done by 2 healthcare workers. Either it can be at a sub-center level done by आंगनवाड़ी वर्कर, कभी नहीं जाती है सब सेंटर पे आशा होती है ना तुम्हारी. Either it is an auxiliary nurse, midwife, ANM, or multi-purpose worker, female multi-purpose worker. So which worker visits at sub-center level? ANM or MPW female? ANM or MPW female, or minimum number of ANM or MPW visits are 3 to 4. These are 3 to 4. यही गलतियां करते हो, इसीलिए बताया मैंने पहले. ठीक है. So minimum are 3 to 4. When 3 and when 4? So please remember, in home deliveries there would be 4 visits. Home deliveries 4 visits. 0, 3, 7, 42. 0, 3, 7, 42. Okay. Whereas in institutional deliveries 3. Institutional deliveries 3, 3, 7, 42. 3, 7, 42. Next, if a ASHA worker in a village visits the home of the mother, minimum visits are 6 to 7. Minimum visits are 6 to 7. Home delivery में 7 visits. Home delivery में, because it includes 0 या 1, 0, 3, 7, 14, 21, 28, 42. 0, 3, 7, 14, 21, 28, 42. In cases of institutional deliveries, 6. It starts from the 3rd day. 3, 7, 14, 21, 28, 42. No issues with this. याद रखना. आशा की कितनी विजिट? ANM और multipurpose worker 3 to 4. No issues with this. A G2 P1 L1 दो बार pregnant है, एक बार parous है, एक बार live birth. G2 P1 L1 female comes to you at 16 weeks. She received 2 doses of tetanus toxoid in her previous pregnancy 2 years ago. How many doses of tetanus toxoid shall we give? So if I talk about tetanus toxoid in pregnancy, guys, please remember tetanus toxoid in pregnancy is given how many doses? How many doses are given? 2 doses. How many weeks apart? 4 weeks apart. But if usually tetanus toxoid is effective for 5 years, but in pregnancy it is only considered up to 3 years. So if a patient is again pregnant within 3 years, and she has received a complete dose of TT previously, then we will only give a tetanus toxoid booster. So next pregnancy within 3 years. पहली में नहीं रिसीव किया तो complete schedule should be given. If she did not receive the dose of tetanus toxoid in her previous pregnancy, complete doses should be given. If she received one dose only, again complete schedule should be given. But if she received complete 2-dose schedule in previous pregnancy and next pregnancy occurs within 3 years, it is only one booster dose. If I talk about if the pregnancy occurs beyond 3 years, if the pregnancy occurs beyond 3 years, usually complete 2-dose schedule should be given. Complete 2-dose schedule should be given. No issues with this, anybody? Now the TT vaccine has been replaced. मतलब चल रहा है. It is replaced by the TD vaccine, that is diphtheria and tetanus. Both are toxoid vaccines. No issues with this. Moving further, jaldi se. Talking about MCH indicators, guys. Maternal and child health indicators. MCH indicators. So MCH indicator first is IMR, that is infant mortality rate or ratio. Infant mortality rate. Infant mortality rate. So it is number of infant deaths. Number of infant deaths upon total live birth into multiplier is and it is a rate. It is a rate. Value for current IMR according to the recent SRS 2022 survey. Infant death. एक आंसर ये क्या भाई 3 to 4 24. So the recent SRS says it is now 30 per 1000 live birth. SRS census 34 बोल रहा था. Now the recent SRS says the last SRS was 32, but the recent SRS says it is 30 per 1000 live birth. Revise करेंगे इसके बाद. Cause the most common cause of infant mortality in India is low birth weight or prematurity or MMR, maternal mortality ratio. Maternal mortality, कुछ books still बोलती है rate, but it is a maternal mortality ratio. Why? The numerator is number of maternal deaths. The numerator is number of maternal deaths, and denominator is total live birth. Denominator is total live birth. Into multiplier is so important for 2 reasons. It is a ratio and not a rate. First, A is not a part of B. Numerator is not a part of denominator. My live birth में से मर रही है क्या? नहीं. So number of maternal deaths is different. Total live births are different, right? So A is not a part of B, and multiplier is 1 lakh, not 1000. Therefore, it is a ratio. ठीक है? And what is the current MMR according to recent SRS? So it is 103 per 1 lakh live birth. The recent SRS says the last SRS was 113. जो अभी भी 122, 130 में अटके हुए हैं, भाई you need to wake up now. ठीक है? So it was recent was 113. Now it is 103 maternal deaths per 1 lakh live birth. And our target is to achieve less than 100 maternal deaths. Our target is to achieve less than 100 maternal deaths per 1 lakh live birth. ठीक है? No issues with this. So per 1 lakh live birth. What is the most common cause of maternal death? Most common causes. Most common direct causes. PPH. Most common direct causes. Most common indirect causes. Most common indirect causes. Under 5 mortality rate. That means a child under 5 mortality rate है. Okay, so number of deaths less than 5 years of age upon total live birth into 1000. Current under 5 mortality rate of India is current under 5 mortality rate of India is 34 1000 live birth. Census के values मत बताओ. The recent sample registration survey is being done, and the best data collecting system of India, because it is a dual record. It is sample registration survey. कोई दिक्कत? Census पूछे तो census बताना. इस बार का तो census हुआ भी नहीं. तुम 2011 की values पकड़े बैठे हो. Recent SRS is 2022. ठीक है? So the current SRS says that the under 5 mortality rate is 34 per 1000 live birth. Most common causes again low birth weight or prematurity. Low birth weight or prematurity. Neonatal mortality rate again. Number of neonatal deaths. Number of neonatal deaths upon total live birth into 1000. Current NNMR 22 per 1000 live birth. Current neonatal mortality rate is 22. नेहा मैम ने यही लिखवाया ना अभी इस बार, नेहा मैम ने यही लिखवाया ना, नोट्स में सही है उनके। 22, पता नहीं तुमने नहीं पढ़े यार, गजब है। 22 per 1 lakh live birth. Cause is again the same, that is low birth weight and prematurity. So majority of the infant deaths usually occur from the first month of life, that is neonatal mortality. Next, perinatal mortality rate. Perinatal mortality means from 28 weeks of gestation till 7 days post delivery. 28 weeks of gestation, that is period of viability till 7 days post delivery. This is called as perinatal mortality rate. That is called as the perinatal period. Okay, so here number of perinatal deaths upon total live birth into 1000 again. Current perinatal mortality rate is around. Current perinatal mortality rate is around. Current perinatal mortality rate जो यूजुअली गवर्नमेंट ऑफ इंडिया की वेबसाइट पे है, क्योंकि फैकल्टीज बहुत अलग अलग बता रही है। आई एम टेलिंग यू फ्रॉम द गवर्नमेंट ऑफ इंडिया वेबसाइट, जो पता नहीं लास्ट कब अपडेट हुई थी, बट वही है। सो एक बार फैकल्टीज, अगर मैं ट्राई कर रहा हूँ फैकल्टीज को रीच आउट करने का, इट इज यूजुअली 26 per 1000 लाइव बर्थ, ठीक है, बिकॉज इट इंक्लूड्स डेथ इन द womb as well as death after delivery also. Early neonatal death would also be included in perinatal mortality, ना? That is why. So ये गवर्नमेंट ऑफ इंडिया का गाइडलाइन है। तो बाकी तुम like I'll ask the faculties and let you know if there is any update. Stillbirth rate. Stillbirth rate. If there is death of a fetus or death of a baby after 28 weeks of gestation. After 28 weeks of gestation, or if the birth length is more than 35 centimeters, of the birth weight is more than 1000 grams, or if the birth weight is more than 1000 grams. So birth weight more than birth length more than and period of gestation more than, anything less is considered an abortion. Okay, after that it is stillbirth. So it is number of stillbirths per total live birth into 1000. What is the current stillbirth rate? It is around 20 to 22. Okay, so 22, and again the cause, here the cause would differ. Here the cause would be maternal infection. Here the cause is maternal infection. No issues with this. Maternal infection is the cause for stillbirth rate. ठीक है, जल्दी से रिवाइज करना है, वैल्यूज बताओ जल्दी। IMRL, MMRL, MMRL 103 per 1 lakh live birth, 103 per. Then under 5 mortality, perinatal mortality, stillbirth rate, and most common cause of stillbirth, maternal infection. Most common cause of stillbirth, most common cause of under 5 mortality, infant mortality, or perinatal mortality, low birth weight and prematurity. Most common cause of MMR, BPH. Most common indirect cause, anemia. Best indicator of health status in a country or a society, it is infant mortality rate. अपने बच्चों को तुम कितना अच्छा हेल्थ दे रहे हो, that is what determines the best health indicator of a society. So best indicator of health status of a society is, best indicator for health status of a society is, best indicator for social development of a society is, best indicator for social development of a society is under 5 mortality rate. Best indicator for social development of a society is under 5 mortality rate. It will tell you how the social development is occurring in the children from 0 to 5. A pregnant female was started on iron and folic acid supplementation. What is the dose and duration? So the duration of iron folic acid tablet given in pregnancy. Elemental iron is folic acid is 500 microgram. Folic acid is कितनी बार दी जाती दिन में? It is once a day. It is a once a day. How many? For what duration? 180 days in pregnancy and 180 days in lactation. ठीक है? So 180 days in pregnancy and 180 days in lactation. What is the frequency? Once a day. What is the dose of elemental iron? 60 mg. What is the dose of folic acid? 500 microgram. Important. ठीक है? Which color tablet आती है ये? Red color tablet. It is a red color tablet. When the folic acid dose would be increased to 4 mg, if there is a history of neural tube defect in the previous pregnancy or the patient is currently on anti-epileptic drugs, okay, then it would be considered as a high risk pregnancy and the dose of folic acid is increased to 4 mg. 4 mg, yeah, 4 mg. 10 times the dose. 500 mcg होता है, 10 times the dose. High risk pregnancy में. No issues with this. Important. Then a child between 6 months to 5 years, according to the ICDS, he also receives iron and folic acid from Anganwadi. So what is the dose of iron? 20 mg. The dose of iron over there would be 20 mg. 0 to 6 months to 5 years. It is usually 20 mg. And folic acid is 100 mcg. Folic acid is 100 mcg. How many times a week? Bi-weekly. It is a bi-weekly tablet. How many times a week? Bi-weekly tablets. और कौन सी कलर की टैबलेट होती है? पिंक कलर टैबलेट. ओके, देन फॉर एडोलेसेंट इज अ ब्लू कलर टैबलेट. ठीक है, नो इश्यूज विद दिस. Breastfeeding now. Breastfeeding till 6 months of after delivery it is. Breastfeeding till 6 months after delivery is exclusive breastfeeding. No other thing should be given. From 0 to 6 months. From 0 to 6 months. From 6 months to 2 years. Only breastfeeding. Yeah, you will start complementary feeding. From 6 months to 2 years. From 6 months to 2 years. But from till 6 months, exclusive breastfeeding. Now, please tell me when breastfeeding should be initiated in a patient, in a child. Better answer than that. It is on the delivery table itself. On the delivery table. So the best answer would be on the table. Best answer would be on the table. So if on the table, if breastfeeding is started, it will decrease the risk of PPH in the patient and increase the milk production also. Okay? So on the table would be the best answer, followed by as soon as possible. Followed by as soon as possible. But both of them are not an option. Normal vaginal delivery mein 1 hour. 1 hour. Normal vaginal delivery mein 1 hour. C-section mein 4 hours. No issues with this. Best answer for initiation of breastfeeding is on the table. Best answer is followed by ASAP. Followed by ASAP. No issues with this. Then contraindications of breastfeeding. इस पे question आ रहा है. Absolute contraindication of breastfeeding from mother's side. It is chemo or radiation. Chemotherapy or radiotherapy. Chemotherapy or so absolute contraindication from mother's side would be maternal chemotherapy or maternal radiotherapy. Absolute contraindication for breastfeeding from mother's side would be chemotherapy or radiotherapy or from whose side? Mother's side. But from fetus side it would be different. So the patient having galactosemia, the child having galacto or lactose intolerance. Both of these are absolute contraindication from the fetal side or the child side. One more important absolute contraindication. Herpes infection involving the nipple. Herpes infection involving the nipple. Okay, that would be a contraindication. Last exam mein aaya tha herpes infection not involving the nipple. Then that is not a contraindication. Maternal HIV, not a contraindication in developing countries, but a contraindication in developed countries. No issues with this. Now, what is this? So here, the mother is trying to give warmth to the child. Okay, so body to body touch is there. That is what is known as kangaroo mother care. And kangaroo mother care is a part of warm chain. So warm chain matlab kangaroo mother care. And there are 3 components of kangaroo mother care. They have asked you as an exception. So what are the 3 components of kangaroo mother care? First is kangaroo positioning. So body to body contact of the child. And it is usually done for premature infants, premature children or low birth weight children who are at a higher risk of hypothermia. And therefore a body to body contact is given. It can be given only by the mother or it can also be given by the father. If not father, then even by the nurse. Okay? So anybody can give kangaroo positioning. Second is kangaroo feeding. What do we mean by kangaroo feeding? exclusive breastfeeding as soon as possible. Exclusive breastfeeding as soon as possible should be initiated. And last is kangaroo discharge. Kangaroo discharge, that is early discharge. Kangaroo discharge means early discharge. Okay? So early discharge. So what are the three components of kangaroo mother care? First is kangaroo positioning. Second is kangaroo feeding. And third is the early discharge from the hospital. No issues with this? Then talking about human milk comparison and cow milk comparison. Protein are high in amount in? Protein are high in amount in? Protein are high in amount in? And which protein is high in cow milk? Which protein is high in cow milk? C for casein, C for cow milk. Which protein is high in cow milk? Which protein is high in human milk? Which protein is high in human milk? Whey protein. Next, carbs are high in? Carbohydrates are high in? Lactose में अगर बोलूं, lactose is a carbohydrate. Lactose is high in? Lactose is high in human milk. Lactose is high in? Therefore, carbohydrates are high in human milk. But fats are high in? Fats are high in? Calcium and phosphate content is high in? Calcium and phosphate content is high in? Calcium and phosphate ratio is high in? Calcium and phosphate ratio is high in? Therefore, absorption would be better in? Absorption would be better in? Okay, no issues with that. So, absorption depends on the ratio, not on the content. Content of calcium and phosphate is high in cow milk, but ratio is high in human milk. Energy given by milk is usually 65 kilocalories. The energy given is 65 kilocalories. Okay, per gram of milk. Okay? Vitamins which are seen in human milk are A and C. Human milk में A and C, except for vitamin D. And vitamin D नहीं होता. Therefore, therefore we will give vitamin D to the child till 1 year of age. Till 1 year of age. And what is the dose? 400 international units. What is the dose? 400 international units. And one more vitamin is deficient in milk. And therefore, we give an injection at birth itself. Vitamin K to prevent hemorrhagic disease of newborn. Vitamin K in preterm dose is 0.5 mg. Preterm it is 0.5 mg. Term it is 1 mg. In term it is 1 mg. Route of administration is subcutaneous. Route of administration is subcutaneous. No issues with this. Vitamin A ka question aa chuka hai. It is to prevent hemorrhagic disease of newborn. So, human milk is high in which vitamin? Cow's milk is high in which vitamin? It is high in vitamin D. But cow milk is deficient in which vitamin? It is deficient in vitamin C. It is deficient in vitamin C. And human milk is deficient in vitamin D. Human milk is deficient in vitamin D. Amino acid. The amino acid which is present in human milk, it is taurine. It is taurine. And taurine is responsible for neurological development. The other amino acid can be cysteine also. Okay? So the amino acid present in human milk, amino acid in human milk, इसमें methionine होता है. ठीक है, no issue. Essential fatty acid in human milk, which is responsible for CNS development again. Docosahexaenoic acid, also known as cervonic acid. So which essential fatty acid is present in human milk? DHA. Which amino acid is present in human milk? Taurine. And both of them are responsible for CNS development of myelination in the child. Iron content and absorption would be high in? Iron content and absorption is high in human milk. Okay, please remember this. Then additional calorie requirement during pregnancy is plus 350 kilocalories. Okay, the additional calorie requirement in pregnancy is plus 350 kilocalories per day. Okay, additional calorie requirement during pregnancy is plus 350 kilocalories per day. Additional calorie requirement during lactation is, so one answer should be, but if they ask you 6 to 12 months, 520. 6 to 12 months, first 6 months, only lactation, 600. Pregnancy, average birth weight of a child. Average birth weight of a child is 2.8 to 2.9 kg. 2.8 to 2.9 kg. Average birth length is? Average birth length is 50 centimeter. The instrument which is used to measure birth length or length is? It is the infantometer. Infantometer is used to measure. Infantometer is used to measure, and length can be measured up till. Length can be measured up till, and the instrument is known as. Instrument is known as. After 2 years of age, we will measure. After 2 years of age, we will measure. After 2 years of age, we will measure height by the instrument. By the instrument stereometer. No issues with this. Next, now if a child is born before term or his birth weight is less, okay, then he would be classified according to the WHO classification. Low birth weight means normal weight of a child is between 2.5 to 4 kg. Low birth weight means less than. Low birth weight means less than. Low birth weight means less than. Moderately low birth weight means less than. Moderately low birth weight means less than. Very low birth weight means less than. Very low birth weight means less than. Extremely low birth weight means less than. Extremely low birth weight means less than. Okay. Then this instrument is known as. This is known as the. And Shakya's tape is used to measure. Shakya's tape is used to measure mid-arm circumference, sometimes also referred to as mid-upper arm circumference. It is one and the same. So it has 3 zones. Okay, it has 3 zones. Please remember, the green zone indicates normal child. The green zone indicates normal child. It is more than 13.5 centimeter. It is more than 13.5 centimeter. Yellow zone indicates mild to moderate malnutrition. Yellow zone indicates mild to moderate malnutrition. It is between 12.5 to 13.5. It is between 12.5 to 13.5. No issues with this. Yaad rakh lo. And last, the red zone indicates severe malnutrition. Red zone indicates severe malnutrition. Red zone indicates severe malnutrition. Less than 12.5. Less than 12.5 centimeters. No issues with this. Jaldi say. Green zone more than. Yellow zone between. Red zone less than. Mild to moderate malnutrition with zone. Severe malnutrition with zone. Normal child with zone. So, MAC is used to determine what? MAC is used to determine malnutrition. MAC is used to determine malnutrition. Then this instrument which is used, it is known as the. This is known as the Harpendence. This is known as the Harpendence. And Harpendence calipers is used to measure. Harpendence caliper is used to measure skin fold thickness. Best site to measure skin fold thickness is triceps. Best site to measure skin fold thickness is triceps. No issues with this. Then this is the field instrument where you hang the child and measure the weight of the child. So the instrument used to measure weight of the child on field is known as the Salter scale. This is known as a Salter scale. No issues with this. So field instrument used to measure weight is. Field instrument used to measure length is infantometer. Field instrument used to measure height is stereometer. Field instrument used to measure MAC is Shakya's tape. Field instrument used to measure skin fold thickness is Harpendence caliper. Then when we call it as severe acute malnutrition, guys, ये question arise होता होगा. So that is WHO definition of severe acute malnutrition. 3 important things are there. First, weight for height less than minus 2 standard deviation. Weight for height less than minus 2 standard deviation. Mid-arm circumference less than 11.5 centimeter. Mid-arm circumference less than 11.5 centimeter. And there would be presence of nutritional edema. There would be presence of nutritional edema. So when you classify the child as severe acute malnutrition of SAM, first weight for height less than minus 2 standard deviation. Mid-arm circumference less than 11.5 centimeter. Nutritional edema present. Okay, no issues with this. Usually it is -3 also. Some books refer to it as -3. Then a child delivered at 40 weeks was weighing 2 kg. What is the most common cause? So 2 kg means it is classified as moderately low birth weight. Moderately low birth weight. First thing. But here the child is not preterm. Here the child is not born before 37 weeks or 34 weeks. So if a child is born at 40 weeks of gestation, that means during term or after the date, then this child is called as small for gestational age. This child is called as small for gestational age or small for date or small for date. And the most common cause for small for gestational age or small for date is IUGR, intrauterine growth restriction. Intrauterine growth restriction. The most common cause for small for gestational age or small for date would be, most common cause for SGA or SFD would be single best indicator for health assessment, or maybe single best indicator for growth or for development of a child or for nutritional status of a child. It is weight. Okay, single weight. Agar diya hoga weight for age. So single best indicator for growth, development or nutritional status. Single best indicator for growth, development or nutritional status. So weight for age is most important. Please remember this. Okay, no issues with this. Acute malnutrition mein, there would be decrease in weight for, and this is known as wasting. This is known as wasting. Chronic malnutrition, decrease in height for age. Chronic malnutrition, decrease in height for age. And this is known as stunting. This is known as stunting. Indicator for acute and chronic malnutrition. It is weight for age. Weight for age. Weight for age. Okay, please remember. Jaldi say. Acute malnutrition indicator is? Acute malnutrition indicator is? Chronic malnutrition indicator is? Chronic malnutrition indicator is? Acute and chronic malnutrition indicator is? Weight for age. No issues with this. And the best overall indicator would be weight for age. Best overall indicator would be weight for age. If I talk about the growth charts, guys, okay? So we have different types of growth charts. The 2 growth charts are accepted nowadays. The first one that I am showing here, you can see lines. The lowest line is the 3rd percentile for boys or girls. 3rd percentile for girls. Whereas the uppermost line is the 50th percentile for 50th percentile for. So uppermost line is pura bolo. Uppermost line is 50th percentile of boys. Upper line is 50th percentile of boys. Lower line is 3rd percentile of boys, girls. Okay. So we have blue charts for boys, pink charts for girls, and these are the WHO growth chart. जिसमें तुम्हें line दिखेगी बस, ठीक है? So between lines you need to see. Whereas if I can see these type of growth charts, again blue and pink for boys and girls respectively. Here you can see, but apart from the lines, there is a zone which is seen. Green color zone, yellow color zone, and a red color zone. So these are the ICDS growth charts. These are the ICDS growth charts. So here the uppermost line is known as the upper reference curve. Uppermost line is known as the upper reference curve. Whereas the lowest line is known as the lower reference curve. Lower line is known as the lower reference curve. So it is equivalent to the WHO standard. That means upper reference curve is 50th percentile for upper reference curve is 50th percentile for boys, whereas lower reference curve is 3rd percentile for girls. Lower reference curve is 3rd percentile for girls. And the area in between, the green zone, it is called as road to health. The green zone is called as if a child falls between the yellow zone, it is a mild to moderate malnutrition. And if the child falls in red zone, it is severe malnutrition. So the yellow zone line is -2 standard deviation and red zone line is -3 standard deviation. No issues with this? A child was diagnosed with severe acute malnutrition. Criteria हमने already discussed कर लिया, right? So important, you need to discuss that. ठीक है? School health, if I talk about, guys, school health was first recommended by which committee? First recommended by? But comprehensive school health was recommended by Renuka Roy committee. Responsibility, school health is the responsibility of PSC. School health is the responsibility of primary health center. School health is the responsibility of frequency of school health is once every. Frequency of school health is once every. Frequency of school health is once every. Now, according to the school health recommendations that they gave, number of students in a single class should be less than per capita space for each child should be more than 10 square feet. Per capita square space for each child should be more than desk, most important. Desk should be of overlap between the sitting and writing surface. Then one urinal for 60 and one latrine for 100 students. One urinal for 60. One urinal for one latrine for 100 students. No issues with this. Yaad rakhna. Then we have this scheme launched by the government of India known as the Poshan Abhiyan. It is the Prime Minister's overarching scheme for holistic growth and development or nourishment. Sahi Poshan, Desh Roshan. This is the logo. This is the tagline. Sahi Poshan, Desh Roshan. And it has a goal of malnutrition free India. It has a goal of malnutrition free India by the time of 2022. ठीक है, इसी साल पे. ठीक है. Next one, here you can see this is the logo for which scheme? Midday meal scheme. This is the logo for midday meal scheme. Along with education, the child will also have food. And midday meal scheme comes under which ministry? Poshan Abhiyan comes under Ministry of Women and Child Development. Poshan Abhiyan comes under Ministry of Women and Child Development. But midday meal scheme comes under Ministry of Education. Okay, midday meal scheme comes under Ministry of Education. HID Ministry pehla naam. Okay, according to this, calories and proteins are given to the patient. How much calories? How much calories? How much protein? How much protein? Out of the recommended dietary allowance. Okay? Then this logo is for ICDS, Integrated Child Development Services. Integrated Child Development Services. Okay? And ICDS, what is the heart of ICDS? Anybody? Heart of ICDS is Anganwadi Center. Heart of ICDS is, but the functional unit of ICDS is Community Development Block. किसने आंसर किया वो? It is Community Development Block. ठीक है? So please remember, अगर snaps पढ़ा होगा उसमें लिखा हुआ है. ठीक है? So functional unit of ICDS is Community Development Block. And Community Development Block will consist how many villages? 100 villages or 1 lakh population. 100 villages or 1 lakh population. This was a question. How many villages are included under Community Development Block? 100 villages or 1 lakh population. And functional unit is Community Development Block. No issues with this. And the heart would be with Sevika, Anganwadi Sevika for this. ठीक है, बाद में discuss कर लेंगे. Family planning contraception next time. Next time का session बहुत लंबा हो सकता है फिर. Ready for that? Thank you so much. Let's meet. मैं तो कर ही देता. स्पीड देखो इनका. Hey, sorry guys, please let me know for tomorrow. Please let me know. मैं